Hi, this is Kelly, and I will be demonstrating trach suctioning according to your check-off list. Okay, so of course I will have checked the order to determine whether it would be intermittent or continuous suctioning. I have knocked on the door, provided privacy, introduced myself to the patient, explained the procedure, answering any questions. I will gather my supplies. I will wash my hands and perform hand hygiene. Okay. I'm donning clean gloves. Okay. For an adult, I want to turn the suction between 100 and 150 millimeters of mercury. Okay. I can go ahead and put my suction tubing here so that it will be ready. And you need to verbalize that you will hyperoxygenate the patient to prevent hypoxemia. This is a sterile procedure, and I will go ahead and prepare my field. You should have a suction catheter tray. It may look a little different than what I have here. So I'm going to open. I'm going to go ahead and open this, touching the outside of the box. The inside is sterile. I can go ahead, pour my sterile water into the box, holding the label to the palm and staying 6 inches above. Okay. I'm going to remove my clean gloves so I can transition to sterile by performing hand hygiene. I'm going to remove the sterile gloves from the package. Okay. I'm going to open my sterile gloves, touching only the 1-inch border. Okay, so I have this suction catheter. It's sterile. This tip is going to attach to the suction. In my dominant hand, I'm going to roll this up simply so I do not touch it on any other object. I want to maintain sterility. This hand remains clean. This hand is sterile. This hand is no longer sterile once I touch the suction tubing. Okay. I connect the catheter to the tube. Okay. Back my hand away, and I know that this hand is not sterile. It will be the hand that provides the intermittent suction. Okay. It's very important that I keep sterility on the tip of the tube. And I want to begin the procedure by lubricating my tube, ensuring that this works, and dipping it into the sterile water. Okay. Now I'm ready to perform the suction on the patient. I want to be careful that I do not touch the tip of this tube on anything. I go directly inside the trach. I'm going to go in. If I meet resistance, I'm going to pull back a little. I'm going to begin to apply intermittent suctioning while gently rotating the suction catheter. It's very important when you go in that you are not occluding the suction. Okay? You need to go in and come out, providing the intermittent suction. When you come out, it's very important that you do not touch the tip of this catheter on anything so that it can still be sterile. At this point, you would verbalize that each pass should last 10 to 15 seconds, no more, that I need to wait 30 to 60 seconds between each pass, and I can perform this procedure 3 times. Skill complete.